What is CAN? Consumer Activity Network, or what the letters stand for. CAN is a peer support organisation. We assist people in the first 28 days out of hospital. We've been running in Sydney for about 8 years with hundreds of people's lives improved. We have a hospital to home program and a follow-up phone connections program. Before explaining what these two programs offer, I'd like to confirm the hard evidence of what we do. Over the years, we've had a lot of successes, a lot of good feedback from clients. As well as that, both in Australia and overseas, recognised university and medical studies are reporting that peer support workers like us, people who have a lived experience of mental illness, can develop safe and valuable relationships with people who are being discharged from a mental health unit. We know what they're going through. We see people as people, not as a diagnosis. We learn from our experience, not from books. And the hard evidence confirms that in tandem with health professionals such as yourselves, we improve lives. Peer support services are effective in encouraging people to move from patienthood to personhood. Benefits include reduced rates of hospitalisation and mental health service usage, reduction of distress symptoms, increases in quality of life, improvement in social support and accommodation, and an increase in volunteer work or employment. Peer support services have been found to be more successful than professionally trained staff at promoting hope and the possibility of recovery. 300 bed days were saved in 3 months of operation of a South Australian peer support mental health service. The conclusion that peer support was a highly effective adjunct to treatment. Consumers involved with peer worker programs like CAN showed increased community integration, quality of life in relation to daily living activities, and a significantly greater level of employment, participation in education, and lower levels of symptom distress. In a 3-year study, 109 people who were involved in a peer support program were matched to controls. The results were that those who attended the peer support program were less likely to be hospitalised within the 3-year study period, and they spent longer in the community between admissions. The two programs we offer are hospital to home and phone connections. These are very successful ways of helping clients re-establish themselves with the pragmatic daily chores of life. As we're all aware, someone on their first days out of an acute psych unit is often going home to an empty fridge, a messy flat, a life in disarray. Having a person like us there, someone who can honestly say they've done the same thing, is a genuine asset. We pick people up from hospital, make sure they've got food in their fridge, paid their rent, kept appointments, and as readmission records show, things that the wider community sees as simple tasks of living are often just too hard to deal with when newly discharged. That's why we're here. In helping life go smoothly for the first 28 days, we drastically reduce the chance of suicide, we drastically reduce the readmission rate. Here's a short video on our hospital to home service.
It took such a weight off my mind when I was being discharged from hospital to know that Richard would pick me up.
Hey guys, how's it going?
Call in and get some groceries.
Your bakery, buddy.
Okay.
And he'd stay with me for a cup of tea when I got home.
Oh, it's pretty good. Settling back in, trying to just get a rhythm back into life and do the normal things that people do.
This is your dog?
Yeah, Summer.
She's beautiful. Hey Summer, how are you?
So how long have you had Summer?
Oh, I've got a couple of years. Yeah.
Okay.
She's not trained, but she's obedient.
She looks good.
So how are you going with all of the logistics of day-to-day life at the moment? Getting to appointments and stuff like that?
Yeah, it's okay. Sometimes I get a bit anxious, walking outside. I'm not used to, the last few years I've been isolated and, I try not to be in public places, but I'm slowly getting there, but it's a bit hard, moving out and about, getting a bit anxious and all that.
Okay.
I know that feeling really well. So we can actually help you. We can take you to the appointments if you like. We can
stay there with you and then bring you back home. Yeah, that'd be fantastic.
Yeah, I would never have got such safe accommodation if it wasn't for Richard. We went to the real estate agent and he helped me get a flat. To be reminded about other important aspects of my recovery, like taking care of myself, eating proper meals and getting enough sleep. And then there's the social aspect. The group activities like Saturday movie day and coffee just helped me to connect with people again, fit back in society.
The other follow-up service we offer is phone connections. After the 28 days hospital to home service, we hope to have encouraged our clients to be engaging in the world around them in ways they find healthy, sustaining and satisfying. That said, it's always good to have a friend, someone you can talk to, and that's where our phone connection service comes in. They give us a call to start things rolling, then we call them once a week, every week, for as long as they like. Here's a brief video about that program.
I've used a few different phone services, but with CAN, you know the person you're talking to has been through it themselves. They're not going to freak out. They're not going to dismiss you or make you feel silly for what you say.
The reason why it's so valuable to me is that I receive regular phone calls from people that understand my recovery, they've got to know me, and I really count on that phone call. Makes me feel a lot less alone and feels like someone cares for my well-being.
Our philosophy isn't about designing a service and asking people to join. It's about asking our consumers what they want and trying to deliver that to them.
The person on the other line has gone through what I've gone through, or as much as I've thought that it would be hard, they weren't dismissive and they were actually very supportive. And it made me feel so much better being able to talk to someone who had empathy and could help me and guide me through the steps that I needed to get back on track.
At CAN, we understand what it's like to live with a mental illness, and we're here to help you. So make a call to us and join the Phone Connections program. It's just one call. That's all you have to do.
A couple of points before I close. What we are is a free peer support worker service. We give support, transport, we listen, encourage and support a person to find their own pathway to recovery. We do not give advice, counselling or crisis management. When we work is in the first 28 days, the most fragile time, then after that 28 days on the phone for a chat once a week for as long as the client likes. We are not a long-term peer support organisation, and we support those organisations and recommend our clients utilise their services. We want to work together with everyone. As Christopher Reeve said in the closing line of the first Superman movie, we're all in this together.